Hi, it's Kristen here at UT Southwestern. Thank you for joining us for our Facebook Live chat with Dr. Mark Drasner on advanced heart failure. We are excited to be here. You know, for those of you that aren't familiar with Dr. Drasner, he is the clinical chief of cardiology and is the medical director of the LVAD and cardiac transplant program here at UT Southwestern. So we're really excited to have him. Thank you for joining us.
Oh, thank you, Kristen. Really looking forward to it.
Should be a good chat. Yeah, before we get started, don't forget to like and share the conversation. We want to reach as many people as we can. You know, it'll be available after the chat if you know people that can't tune in. And be sure to ask your questions in the comments section. We'll be following along throughout our 30 minutes and taking as many as we can get to. Now, before we get started, I do have kind of an easy question for you, Dr. Drasner. Wanted to find out what motivated you to become a cardiologist?
Yeah, I think, going back to medical school, it was just an area that always fascinated me, the physiology of the heart. Then I kind of fell into the field of heart failure when I was finishing up my cardiology fellowship, and kind of grew into loving taking care of patients who have this condition. So
Awesome.
I was a fortunate person to find something that I really enjoyed doing.
Well, that's a great segue into one of the questions we wanted to talk about, and that is something that I hear there's lots of confusion about, and that is what exactly is heart failure and how does it differ from a heart attack?
Yeah, so the name heart failure actually has generated a lot of discussion recently. Some physicians are actually suggesting perhaps the name should be changed because it sounds like the heart fails and the person's going to die. That's not what heart failure is. Heart failure is we use the term medically, it describes a group of symptoms that a patient might have. And as opposed to a heart attack, where a patient has an interruption of blood supply to their heart muscle in a specific event and they develop damage of a part of their heart muscle. Now, what's a little confusing is that heart attacks can lead to heart failure.
Okay.
But a heart attack is specifically an interruption of blood supply to the heart, whereas heart failure is when the heart is usually either weak or stiff, and then patients develop symptoms like shortness of breath or leg swelling.
Okay, so it's not when your heart doesn't. Some people think your heart just completely stops. That's
right,
not
and
correct.
that's what I think confuses people. And when they hear the word failure, they think that's it. My heart's failed and I'm going to die.
Yeah.
That's not what heart failure is. It's a group of signs and symptoms that a person may have, and they can live with for many years, in fact.
Okay, that's really good to know. So we see that people are starting to join our chat. That's great. Don't forget to add your questions in the comments section. We're going to take a question we had from previously that came in from Clayton Everett. Clayton, he was wondering, what diet and lifestyle changes do you recommend to lower your risk of developing advanced heart failure?
Definitely, because of course prevention is key here. We want to prevent people. It's much better to prevent someone from developing heart failure than having to treat it.
Absolutely.
So a lot of the advice there really is kind of common sense advice. If, for example, you have diabetes, you want to make sure that you're eating a diet appropriate for that to keep your blood sugars low. Good exercise, if you can prevent yourself from developing coronary disease and preventing yourself from having a heart attack, then you're less likely to develop heart failure. So those are the things that we all know about an American Heart Association type healthy diet, low in fat, low in cholesterol. Another big risk factor for developing heart failure is hypertension, high blood pressure. And once you have high blood pressure, then people suggest also a healthy diet, and also there probably lowering your sodium intake would be beneficial in terms of trying to control your blood pressure.
Okay, this is a really good question, Clayton. Thanks for submitting it. So we're starting to get some others, and we have questions also from Sarah and Rebecca. We will get to these in just a second. We have one here from Lori. Lori says, what is the difference between heart failure and advanced heart failure? And is advanced heart failure common?
Yeah, Lori, that's a great question, and that's a very important area to talk about. So within the broad spectrum of heart failure, there are a group of people who have the most serious type of heart failure, the most advanced condition, and we call that advanced heart failure. Now, in the medical literature, people talk about that as a group of patients who need specialized interventions. People who might need a heart transplant or an LVAD, which perhaps hopefully we can get to later.
Right.
But in general, the patients who have advanced heart failure are the patients who are the sickest among the large group of patients with heart failure. They're the ones who are being in and out of the hospital. They can't stay out of the hospital, or perhaps they're just always so symptomatic that even something as simple as taking a shower, they would get short of breath.
Wow.
And so these are, when we talk about advanced heart failure, it's the sickest patients within the broad spectrum of patients who have heart failure.
Gotcha. Okay. Really good question, Lori.
And in fact, it is not that infrequent. People estimate that there could be 250,000 people in the United States who have advanced heart failure. So it's not that rare, and it's something that's important if you've been first of all, it's important to know that if you've been diagnosed with heart failure, that does not mean that you have advanced heart failure. So when we talk about that, I don't want everyone to think who has heart failure, that's what is going to happen to them. But it's also important that people start to, if they are progressing to that point, that they are aware that they have progressed into this condition of advanced heart failure.
Okay, that's a good, and we should get back to that in just a second. We have a question here from Janie. So Janie says, if you have a bicuspid aortic valve with moderate stenosis, can someone end up with heart failure? Is that one of the predictions?
Yeah, so thank you for that question. And yes, valvular heart disease is another cause of heart failure. And really, whether it's the aortic valve or the mitral valve, any abnormality that usually has to get progressed to the severe if it's an isolated valve problem leading to heart failure. But yes, certainly aortic valve, whether it's narrowed and tight or leaking, or the mitral valve, whether that's narrow or tight, also can lead to heart failure. So that's another cause of heart failure.
Okay, really good question, Janie.
And I should add, the nice thing about valvular heart disease is that a lot of that, if you fix the valve, you can fix the problem. And so if someone has valvular heart disease, you certainly want to be followed for that and ideally intervened on before you develop heart failure. Okay,
good point. So that does bring up studies. Is there a way that somebody can tell, somebody that has heart failure, that they have advanced heart failure? I assume that's something that they really need a clinician to diagnose.
Yeah, that's something that I'm glad we're talking about, because I think it's important for people who have heart failure to start to educate themselves about this condition of advanced heart failure, because it turns out that in fact there are what we call simple clinical clues to alert the person that they may have advanced heart failure. And these are not really things that, as we'll talk about, not really things that a physician has to tell you. The people listening say, oh, this sounds like me. I might have advanced heart failure. The most common and the easiest is if you've been in the hospital twice for heart failure in the last 12 months. That in itself says that you have advanced heart failure.
So twice in the last 12 months.
If you've had to be admitted to the hospital 2 times in the last 12 months for heart failure, that in itself defines you as being within this condition that we call advanced heart failure. If many patients with heart failure build up fluid in their body, and so they're on water pills. These are medications to try to keep the extra fluid off their body. If you're having to have higher and higher doses of those medications be used just to keep the fluid off, that's a warning sign that you may be progressing to advanced heart failure. So if you see many patients use a medicine called Lasix, and if your Lasix dose has to keep being escalated, increased, that says something's going wrong and that you may be progressing to advanced heart failure. So another one is that if you start losing body weight, so if your normal weight is 180 pounds, and you just get full quickly and you can't eat as much, and you start to lose weight and you're down to 160 pounds, that's very worrisome, and that's another clue of advanced heart failure. So there's many what we call simple clinical clues, but I think the most important for people listening to us is the hospitalization. And that doesn't take a doctor to tell you. You know if you've been in the hospital.
We hope so.
And what I would suggest is if that's happened to you, that you should ask your doctor, can I get referred to someone who takes care of patients with advanced heart failure? Because there are things we can do to help people. And so we see patients, sometimes it's sad because we'll have patients transferred in the middle of the night, critically ill, on death's doorstep. And we'll go back and we'll look in their chart, and we'll see that they had been admitted to the hospital 3 or 4 times in the last year. And we'll see that their Lasix dose had been increased, or maybe they were losing body weight, or
there was signs
that are not subtle either, once you kind of know what to look for. And so one of the objectives I'm hoping we'll get out today to our audience is that these are things that if you're a patient and you do have heart failure, these are things that you should be paying attention to, again, being hospitalized. And if that's happening to you more than once in the last year, ask your doctor, hey, maybe I can go somewhere to physicians who take care of this particular condition, advanced heart failure, and see if there's anything else that can be done for me.
It's really good advice, and it ties into this question that we got in from Crystal. She says, does advanced heart failure usually occur around a certain age? Are there certain decades it happens in? Is it pretty across the board?
Yeah, so heart failure in general, from an epidemiological or population level, is a disease of the elderly. So your risk of heart failure keeps going up as you get older. And so most patients who have heart failure, from a societal perspective, will be patients who are advanced age. So as you start to get to your 70s and 80s and beyond, the risk of heart failure really goes up. But there is a misperception that means that if you're young, you can't have heart failure, and that's wrong. Even though it's not as common, we see plenty of patients who are younger who have heart failure. And so it's not just, another message is it's not just a condition of the elderly. Classic case would be some women after they deliver a child. 1 in 2 or 1 in 3,000 women, who deliver a child will develop heart failure. And so obviously that's a young group of patients, or patients who, as we talked about before, valvular heart disease may have it at a young. Patients who were treated with chemotherapy when they were a child and they had a cancer. There's a broad range of conditions that may lead to heart failure at a young age.
Okay, good to know. So that sides into another topic. What sort of treatments are available when you have advanced heart failure? I think you mentioned earlier LVADs. Let's talk a little bit about that.
Yeah, so in general, when you have advanced heart failure, and again, that would be defined as perhaps needing specialized interventions. So what that's really meaning is moving beyond the typical medicines that are used for heart failure. And by the way, I do want to emphasize, most patients with heart failure, the medicines will work. So if people are listening to us, or you're listening to us and you have heart failure, I don't want you to freak out. Most of the time, if you have heart failure, you can be well treated, well controlled with medicines. We're going to talk about the small group of patients who progress into the medicines don't work. And if you're in that smaller group, then one of the treatments that we talk about are left ventricular assist devices.
Gotcha.
And these are partial artificial hearts that get implanted in the body and basically help deliver the blood around your body because the heart itself is too weak to do that.
Gotcha.
And it's been, I've been in the field now 20 years, and the field really has progressed almost breathtakingly in the last 2 decades. From the initial pumps were that big and noisy and loud, and now we're down to pumps that are literally that size.
Wow, that's amazing.
And they're quiet. And so it's really gone from a therapy that was not adopted at all in any meaningful way to now there's this exponential increase in the number of patients who are getting LVADs because the technology's gotten better. And seeing this unfold, I can only imagine where we're going to be in the next decade or 2 decades. How small can we get these pumps? How reliable can we get these pumps?
So does somebody that has an LVAD, does that automatically mean they need a transplant?
So the left ventricular assist devices, these partial artificial hearts, we got the most experience with them for patients who were potential transplant candidates because, as you probably know, we have to wait until the organ becomes available, and some patients before we had the LVADs literally couldn't live long enough until the organ became available. I vividly remember as a fellow watching, and in fact this was a 35-year-old person who was in a coronary care unit who had valvular heart disease, and we tried to keep him alive with the technology we had back then, and we couldn't, and he ended up dying. And now that would never happen because we could put the LVADs in and keep the patient alive until the heart transplant becomes available. Well, it worked out so well in that group of patients. The thought was, well, if it's working so well in that, why don't we start using the LVAD for patients who are not transplant candidates?
Gotcha.
And that is now called what we call destination therapy, meaning the destination is the LVAD rather than transplant. And that is really the large growth potential because there's a lot of elderly people who would not be transplant candidates who the medicines are progressing to advanced heart failure. The medicines are no longer working, and before we didn't have anything to offer. And now we have these LVADs, even if we've implanted people even 81, 82 years old.
That's amazing.
And so that really is kind of it's a game changer for us because now we have a therapy for these people, these large number of people who have this condition of advanced heart failure.
Awesome. Well, we've got a couple other questions that have come in, so
Excellent.
Thank you. So we're going to take the one. This one is from Rebecca. So Rebecca, her question is, hereditary heart disease is on both sides of my family. I'm 58 years old, and and wondering if she should be on some type of preventative medications. Apparently, they've said she was a ticking time bomb because of history. Do you have any information and suggestions for Rebecca?
Yeah, Rebecca, this really goes back to what we were talking about before about prevention. And what I'm going to do is put a plug in for another specialty. I'm an advanced heart failure, but there's another specialty of physicians who are preventative cardiologists.
Okay.
And they are specifically trained and interested in helping people who might have a striking family history. And so I would definitely recommend seeing a preventative cardiologist. We have them here at UT Southwestern. Other medical centers, I'm sure, have them as well. But if you are told that you are a ticking time bomb and there are relatives on both your sides, specifically if they've had early heart disease, and it was me, I would definitely go see a preventative cardiologist, because they may be able to do something to prevent you from following what happened to your parents or relatives. And we all know genes are very strong. They're very powerful. And so you really don't want to ignore that.
Okay. Really great question, Rebecca. Thanks for asking it. Let's see. We've got one from Melanie. She says, her question is, what problems are heart failure patients at greatest risk for?
Yeah. So I'll talk about the life of a patient with heart failure, because I think that'll answer the question.
Okay.
First of all, the life can be difficult when the condition is not well treated or compensated. So just to give you a sense of what it might be like, patients can't even walk a block sometimes. Or we mentioned this earlier, they have to rest while they're taking a shower or getting dressed in the morning. Or they can only eat half what they used to eat because they get full quickly. And so that's a lot. I mean, if I step out of my role as a healthcare provider and think about a relative having that, that's a lot. But then on top of that, they are at risk for what we call sudden death, which means the person is seemingly to be doing, they're at their baseline, they're doing okay, and then unexpectedly they die from a heart rhythm.
Wow.
And so we have devices what are called implantable cardiac defibrillators, or ICDs, to prevent that from happening. But that's one of the real big fears that we all have, that it's like a lightning bolt. Like the patient seems to be, in their baseline state, and then all of a sudden they're stricken down. So that's the one that scares me the most, because sometimes it's so unpredictable.
Yeah.
Fortunately, we do have the ICDs, which have been shown to prevent that and save many lives and things like that. But those are I think the quality of life, being in terms of being what you're at risk for heart failure, the impact on your quality of life, and then also this risk of having sudden death happening, I would say would be the two I would mention.
Well, yeah, definitely.
Yeah.
So we've got another question in here. This one came earlier from Sarah. And I believe we've addressed it a little bit, but Sarah's wondering, do doctors inform patients and their families when the patient has reached that, end stage congestive heart failure? Yeah,
I think that I think is one of the real key questions that I'm hoping to get across today, because from what I see, not always. And it's sad for me when I see patients who the signs were there if people just kind of knew to look for them. And in addition to talking to other healthcare providers, I'm now of the mindset that I think we need to go to the public and the patients, and empower the patients who have heart failure to know, look for these things. These are not hard to see if you know what to look for, and empower them so that even if their healthcare provider is not calling that out, they know, and they can be proactive and say, hey, I heard I might have advanced heart failure. Can I go get some help for that?
Okay. And that, again, that was you've been hospitalized for heart failure twice in a year, you had additional medications for the water.
Yeah, the dose of your diuretics or your water pills are going up, you're losing body weight, you've been in the hospital a couple times, or at least twice in the last year. And then if you, no matter what your physicians are doing, your healthcare team is doing, if you're still short of breath, getting dressed or showered in the morning,
something there,
or even walking one block, and it's thought to be due to your heart failure, that I would say you should go get evaluated and see if there's something else that can be done to help you. Because that in itself tells you that the person's very limited and very likely could be within the spectrum of advanced heart failure.
Okay, good to know. So we've got, looks like we have about 8 minutes left, everybody. These have been great questions. Keep them coming. We've got a couple more on the books already, and we will take those now. So the next one is from Jessica. Jessica says, what EF is considered out of HF? Not quite sure.
Yeah, I think, yeah, sure, absolutely. So first of all, for everyone, just to get her on the same page, EF is what we call the ejection fraction.
Okay.
And I'm very glad to hear that she's attuned to asking about her ejection fraction, because that is one of those, when we talk about know your numbers, as a heart failure, if you have heart failure, you should know what your ejection fraction is. So I'm really glad that she's been educated to that.
Great job.
Awesome. Now, what the ejection fraction is basically it's a measure of how much blood your heart pumps every time it beats.
Okay.
So, for example, if you start, let's just pretend you have 100 units of blood, and your heart squeezes down and ejects 60 of that, your ejection fraction would be 60%. And that's normal. A normal heart, in fact, does not eject all the blood that it starts with.
Okay.
It ejects about 60% of what it starts with. That's normal. So patients who develop heart failure from a weak heart, that number can go as low as 15 or 20. And but the more subtle point, I'm glad that you should know your ejection fraction, but the more subtle point is that you can have heart failure even if you have a normal ejection fraction, or even if you have a low ejection fraction. So heart failure is just the patient having the signs and symptoms, and that can happen even if your ejection fraction is normal, or if your ejection fraction is low. But if you have an ejection fraction that's low, and you start hearing about an ejection fraction under 20%, that's saying that something is going seriously wrong, and that in itself, I would definitely want that person to be seen at least by a cardiologist, for sure. And depending on what that goes, maybe even a heart failure cardiologist. But if you're out there and you're told that your ejection fraction is under 20%, it's my belief that that person should definitely at least be evaluated by a cardiologist to see what's going on. It's a little complicated because you can have bad heart failure even if you have a normal ejection fraction, but still I think it's a number that's worth knowing.
Wow. All right.
So great question.
Yeah, no, that's a great question. All right, so let's see. The next one is from Mika. She says, her question is, what are some steps I can take while I'm younger to prevent advanced heart failure? Sounds like that may go to the preventive cardiologist.
Yeah, I think the preventive cardiology and the healthy lifestyle, it's kind of things that, our mom probably told us, eat healthy, exercise, take care of yourself, don't do drugs, eat a health diet, and get enough exercise, manage your stress, all those things. Try to prevent. I think if you can prevent yourself from developing coronary disease, and of course your weight is another big component, try to maintain a healthy body weight. Try to prevent from getting diabetes and hypertension, because we know that diabetes and hypertension are huge risk factors for developing coronary disease and then also developing heart failure. So those would be the things I would recommend to try to prevent you. The best way to prevent advanced heart failure is prevent heart failure. And one of the key things about preventing heart failure is try to prevent developing coronary artery disease, blockages in the blood vessels. Keep your weight controlled, and try to prevent or control your blood pressure and diabetes.
Okay. That brings up a good question that somebody asked beforehand. They were wondering, there are new blood pressure guidelines. I mean, is that something that plays a role in heart failure, in advanced heart failure?
Yeah. So blood pressure control is absolutely critical. This is really moving well upstream of advanced heart failure.
Right.
But for the public listening to us, know your number. Know what is your blood pressure. And you don't want to take what I'll call the ostrich approach and kind of ignore it and say, oh, it's not. And the thing is about blood pressure, a lot of times, you may not feel it. And so patients don't, I feel fine. But over the long haul, that is going to wear out your heart. And you got to get your blood pressure down. And we have new guidelines targeting even lower levels. So millions and millions of Americans now who weren't classified before now are being classified. But get your blood pressure checked, talk to your doctor, be proactive about it. If your blood pressure is not under 130 and you can't get it, it's only under 140, 130, and it's still up, you're hearing numbers of 150, 160, don't accept that. Go get that blood pressure down. Over time, it's going to wear out your heart and you're going to end up with heart failure. So get your blood pressure down.
Listen to Dr. Drowsby. That's perfect. All right, we are winding up. We've got time for maybe one or two more questions. So if you haven't asked your question, now is a great time to get it in. One person did ask, they wanted to find out, and this came in ahead of time, and I can't remember what her name is. I apologize for that, but she was wondering, is advanced heart failure, is it genetic? If my parents or my grandparents had heart failure, is that something that I'm more likely to have?
Yeah, that's another really great question, and I didn't cover all the causes of heart failure, but in fact, we are increasingly recognizing that genes are powerful, And there's a large group of patients who have heart failure with no blockages. And we used to call that idiopathic, meaning we don't know why you have it. But now, as we've gotten better at sequencing genes and finding mutations, probably a large percentage of those patients, in fact, have a genetic cause.
Okay.
And so, yes, if your parent or relative, anyone in your family, has heart failure, and in particular, if they have heart failure and they don't have blockages in their blood vessels.
Okay.
So my relative has heart failure, but they've never had a heart attack. They don't need a bypass surgery. There's no blockages in their arteries. That type of heart failure is the type of heart failure that could, in fact, be passed through in families. And in fact, one of the recommendations, it would not be unreasonable, in my opinion, if someone in your family has that type of heart failure, whether it's your mother, your brother, father, any direct relative, for you to go and get your ejection fraction measured. It's a non-invasive test. It's an echocardiogram, because it does run in families. And I'll give you an example. I've taken care of patients, and they come and they have heart failure, and we say, we don't know why you have heart failure. We don't see any reason. They have no blockages. They've never had blood pressure. They've always done a healthy lifestyle. And they have heart failure for no reason. And I say, I don't know why you have heart failure, and that's not uncommon. Fast forward 5 or 10 years later, patient comes back to me and say, oh, the funniest thing happened. Well, it's not really funny, but the most unusual thing happened. My daughter just got diagnosed with heart failure. And so I was seeing the mother.
Right.
She was the first person in the family. And then 5 or 10 years later, a second person in the family developed heart failure.
Wow.
And so that's why I think if someone in your family has that type of heart failure, again, in the absence of coronary disease, that it would be reasonable for your relatives, those relatives of that person, to at least go get an ejection fraction measured, and they may be found to be the second person in the family. And the nice thing is we have medicines. When you catch it early, we can reverse that. So we have easy medications that in a third to a half of the cases, we can take an ejection fraction that's that low and make it close to, if not normal.
Wow.
So you want to be proactive and catch it early, and we have definite therapies to help people like that. So I'm really glad you asked that question, because the familial aspect of this is super important. And of course, here at UT Southwestern, where the genetic work here is just groundbreaking, internationally renowned. And in fact, I'm fortunate. I send many of my patients to Dr. Helen Hobbs, who's a world-class geneticist, and she helps us evaluate those patients for the genetic component of their illness.
Yeah.
So familial cardiomyopathy is something that is increasingly being recognized. And if someone in your family has that, go get your ejection fraction measured.
Perfect. Well, we are out of time. But I would thank everybody for tuning in. We had a great audience. Thank you for all the wonderful questions. Don't forget, please share this chat afterwards. It'll be available here on Facebook, and we'll also post it on our YouTube channel. Then tune in next week. We're going to be talking about depression during the holidays, and we're looking forward to that chat. But in the meantime, please, thank you, Dr. Drausner, for joining us.
Oh, thank you, Kristen. I really enjoyed it. Thank you so much.
Absolutely. Thank you.